Hello, and thank you for choosing Northwest Specialty Hospital. My name is Mike Varga, Director of Pharmacy. As you have already heard from the pharmacist, we will be discussing your Lovenox or Enoxaparin therapy today. So why are you on Enoxaparin after surgery? As a post-op total joint patient, if we were to do no intervention, you would be at an increased risk of developing a potentially harmful clot. With interventions like sequential compression devices, TED hose, early physical therapy, and chemical clot prophylaxis, in this case, enoxaparin, we lower that risk as much as possible. Enoxaparin works in the body by inhibiting clotting factors, which are responsible for forming clots. Enoxaparin does not completely stop this process, rather slows this process down, so after a surgery like a total joint replacement, your risk of developing a potentially harmful clot is extremely low. So what should we watch out for with regard to dangerous clots? There are three main areas of concern we will discuss: the deep veins of your calf, your lungs, and your brain. A clot in the deep veins of your calf is called a DVT, or a deep venous thrombosis. Thrombosis is another word for a clot. It usually presents in one leg or the other, not both, and is more common in the operative leg. It usually presents as a red, swollen, painful calf that can be warm to the touch or even clammy. If you are unsure if you are experiencing a DVT, please call your surgeon immediately or get to the emergency room. If the clot in the leg becomes large and unstable, it can break off and travel, and it usually will travel and get caught in the lungs. This is called a PE, or a pulmonary embolism. Embolism is again another word for a clot. If you were to experience a PE, you may have shortness of breath, wheezing, coughing, and potentially coughing up blood. This is usually accompanied by a localized pain in your chest. Your body does a good job of letting you know something is not right. Please listen to your body, as this is a medical emergency, and you will need to get to the emergency room as soon as possible. The last and least likely clot we are concerned about is a clot in the brain, or a stroke. As a patient, you would experience blurred or lack of vision in one eye, numbness or tingling in the face along one side of the body, slurred speech, and confusion. A caregiver might notice facial paralysis, confusion, lethargy, or tiredness. This is again a medical emergency and requires a trip to the emergency room as soon as possible. All of the clotting events I have described are extremely rare when a patient is on chemical clot prophylaxis and are doing their physical therapy exercises according to plan. We do not intend to scare you with this information, rather give you the tools you will need to identify should you experience any of the clotting side effects described. The opposite effect, and more common, are signs and symptoms of bruising and bleeding. Signs and symptoms of common non-emergent bruising and bleeding are minor bruising, minor nosebleeds, and possible bleeding of the gums when you're brushing your teeth. When on enoxaparin therapy, the most common bruising is at the injection site, which usually looks like someone has drawn on you with a small pen. When you injure yourself, you will bruise more easily. However, all of these are usually minor, and unless any bleeding is unable to stop after 15 minutes, do not require physician intervention. Signs and symptoms of major bruising and bleeding include large diffuse bruising around your trunk, especially when you cannot remember a trauma to the area, large amounts of bright red blood in the urine or stool, Coca-Cola colored urine, or coffee ground or black tarry stools. These can be signs that we have a bleed happening inside the body. If you experience any signs and symptoms of major bleeding, as just described, please contact your surgeon immediately to determine if you need additional care. Again, it is not uncommon to bruise more easily when on enoxaparin therapy, but major bruising and bleeding events are extremely rare, especially because you will be on a prophylactic or preventative dose of enoxaparin compared to a larger treatment dose. In clotting prophylaxis, enoxaparin is given as a 40 milligram subcutaneous self-injection once daily. Timing of the injection, whether morning or night, is not important. However, remembering to give the dose around the same time each day will give you the best results. I will now go over how to administer a Lovenox or enoxaparin injection using an artificial dummy tummy. The area suitable for the injection is the subcutaneous or fatty tissue around the abdomen at least 2 inches away from the belly button. Anything below the rib line to the pelvis is fair game. Again, you want to be 2 inches away from the belly button and from the ribs to the pelvis. When giving the injection, you will want to sterilize the area first with an alcohol swab, which can be purchased at your local pharmacy. Sterilize the area and allow it to dry. Sit in a chair that will allow you to slouch to make it easier to manipulate the subcutaneous tissue. Remove the cap of the injection, being careful not to push the needle toward the finger. You will notice an air bubble in the syringe. Please do not try to expel or remove the air bubble. If you do, you can lose a large amount of medication as the dose is very small. This needle is extremely fine and will cause very little to no pain. Inject softly straight into the belly at a 90-degree angle. Administer the medication and hold the needle in place for 5 seconds. Remove the needle by pulling the syringe straight back away from the stomach. If a small amount of the medication or blood comes out after the injection, please apply a small amount of pressure for 10 seconds. Apply a Band-Aid as needed. The enoxaparin syringe has a built-in safety device. Press firmly on the bottom of the plunger of the syringe to activate the safety shield, which will cover the needle. Please dispose of your used injections in a sharp container or an empty milk jug. You will be on enoxaparin for an average of 14 days, the duration to be determined by your physician, and if you have any questions regarding the duration of your enoxaparin therapy, please refer to your discharge instructions or surgeon's office. It's very important to let your physician know of all the medications you are taking, as enoxaparin can interact with certain medications. One group of medications that can put you at an increased risk of developing a bleeding side effect are known as non-steroidal anti-inflammatory drugs, or more commonly, NSAIDs. These medications include Advil, ibuprofen, Aleve, naproxen, or aspirin. These medications should be avoided while you are on your enoxaparin therapy. The pharmacist will go over your specific medication list to see if you are taking any medications to avoid while on enoxaparin. At this point, we have completed the informational portion of the video. Upon the return of the pharmacist, they will go over your specific medications and be able to answer any questions you may have. It will also demonstrate how to properly administer an enoxaparin injection into a dummy tummy to ensure you feel comfortable giving a subcutaneous injection. Feel free to ask the pharmacist about medications you are taking at the hospital, as well as any medication actions or side effects. Please refer to the handout the pharmacist will provide for a link to the hospital website if you should need to watch this video again. Thank you for choosing Northwest Specialty Hospital for your recovery. We hope you have an excellent stay and the best of luck with your recovery.